thing that's kind of interesting about pelvic and spine and all that is anecdotally, I don't know if anyone's ever done a study on this, but elite athletes who are just in amazing condition frequently have a problem
Mhm.
because basically their pelvic structure is so tight that it has problems
Mhm.
moving to get baby out. And it's like, ow, that's unfortunate.
Yeah.
I'm like, that sounds so unfair. They're in such great shape. They've worked so hard to have the optimum body, and it doesn't work for childbirth. They say, oh, childbirth is like running a marathon. It's like, well, actually, people who run marathons are probably less able to birth vaginally than people who don't.
The other thing about, loosening up your pelvis and letting that happen, something that I dealt with during both of my pregnancies was that very, very, very early on, I started to have pain in my sacroiliac joint. So the joint where your pelvis and your back connect to each other. And it's most likely just because, once you get those hormones in there and things do start to loosen up, it's more mobile, it moves, and it hurt a lot. Like every time I took a step on that side, I felt like a jolt of pain go up my back. And so it's like a lot of things when it comes to birth is that there's this balance that has to happen, right? Like you need your pelvis to loosen up a little bit for the baby to come out. If it loosens too much, you're going to be in really, really bad shape. And it's not a very big difference between not enough and too much.
Right.
So if there were things we could do, which I don't know that there are, but if there were things we could do to loosen up your pelvis, it might not be a good idea anyway.
Nope. Ask
Yeah.
anyone with SPD
Yeah,
pain.
exactly.
I
And
mean,
so like I had to starting in my second trimester wear like a stabilization belt just to be able to be mobile enough to walk because it started, and I was in good shape. I was working out. I ran all the time before I got pregnant. I kept running into it into my pregnancy. I lifted weights until like a week before, like until my due date with my second baby. Like I was working out a lot. I was in good shape. I had to modify some things, especially because of this issue. But it's really just that pregnancy caused this mobility, which was a bad thing in this case. So um, just because you can, which we can't, but if you could, it might still be a bad idea to do that, even if it would turn your baby around, because who knows what it's going to do to your like stability as the person
yeah.
caring for the baby.
I mean, the good thing is that unless you have a connective tissue disorder, any problems that pregnancy creates usually joint wise go away after you're done being
Yeah,
pregnant.
and mine did. I went to physical therapy right away after my
Oh,
second
good.
baby, which helped a ton to like just start strengthening up immediately. I love physical therapy. Everybody should do physical therapy. Like, it's amazing.
Yeah, I think we should have behavioral health and physical therapists on every street corner, personally. Stop in, do a half an hour, a couple times a week.
I don't know why we don't. Well, I do know why we don't. But if in a perfect world, we'd all get a physical therapy consult during pregnancy to be like, here's how we're going to get your body back to feeling okay for you when you're done. Like giving over so much of your body for your baby. Here's how we're going to help you feel good again.
Oh, yeah, because one of the things I almost want to kick someone every time I hear it is, well, you just had a baby. What do you expect? I'm like, I expect to get my old body back sooner or later. Sooner would be nice.
Or if not your old body back, at least a strong and functional
Functional
body.
body, I don't want, but
Exactly.
yeah, you should not just be expected to sit and suffer just because you had a baby. That's not an excuse. That's someone being lazy. That's someone not doing their job. That's someone not saying, oh, you're suffering. This is impacting your function. You're you're not able to be the best you or the best parent that you can be. Let's help you, because that's not the way life should be. Instead, it's kind of like shrug, oh, sorry, had a baby, move on.
Yeah. They do. I wish they did have the therapy. Oh my gosh. Physical therapy after would be great because it's like your body coming down from everything. And like, you felt so loose and then you get so tight and then you have your kid and then you're trying to do stuff. And it's like, they always talk about mommy muscles and it's like, now your core's all messed up and you've got like, you might have, some people have pelvic floor issues. Like there's so many things that can happen during pregnancy that's like, now you have a baby and now you're doing all this stuff. And it's like, and your body is just, it just went through the ringer and there's nobody on the other side to help you like know how to hold your baby properly, or you know what I mean, like that's even something, is a lot of us like tilt way back or we do stuff and it's really bad for your back, and like there's so many things, like your posture gets all messed up and all that from having babies. And it's like, yeah, I got like my stomach's never went back to being the same. I've never been able to do yoga like I did before even being pregnant. I struggle with yoga after all these years, and I went to doctors after having, Rainbow here. I went to doctors and was like, I would like to have my muscles back together. Can you send me to a therapist, like, a physical therapist to help me heal myself and strengthen my core body, because I can't do yoga. I can't do regular functioning things that I enjoy. And they said, oh, well, you don't need that. Here's a surgeon's number. Go to the surgeon. And then I go see the surgeon and I was like, I want my body to be fixed so I can do things because I'm, whatever. And then the surgeon says, well, make sure you're done having babies and come back to me and we'll discuss this kind of thing. And just know your insurance might not pay for it either. And then I'm like, what the heck? I was like, I just want to, like, yeah, I've dealt with all that ridiculous stuff where I was like, I'm never going to do yoga again. And when I said to the surgeon, I said, look, I can't do plank. I can't do regular yoga things that are like in almost every yoga video. And he's like, well, I don't know who your yoga instructor is. And I was like, no, listen to me. My body can't do it. Like, you don't understand. My stomach is doing this. Like, so if I'm trying to do certain things, I can't get it to stay in. It's falling out. It's very uncomfortable. It's very painful. It hurts my back. It hurts whatever. I was like, this is not good. And this is why I'm here. And they all just kind of were like, oh, well, literally, I get told I've seen worse.
Ugh.
And I'm like, but what does that mean for me as I'm here trying to get care?
Mean.
Yeah, I've heard it like many, and they're, and it's, and I'm little, so everybody kind of is like, well, you're little, and I'm like, I know, but your core is like it's your whole body, like, you know what I mean? Like, that's your whole body. So when your core is messed up, it's like, and finally I found out from OBs, because I was like, I want my body fixed. And they were like, well, if you have another baby, when you do your C-section, we can sew your muscles together. And so I was like, fine, let's do it. I don't care. I was like, just do it so I can have my body back. I don't care. So like, literally that's my only option at this point, is to get and I hate that. And I see it all the time online from so many women.
It's sad because there's a huge difference in how this gets treated and how that like postpartum body issues are handled. For me, because I was in so much pain during the like parts of my pregnancy, I brought it up with my OB. She gave me a referral for physical therapy before I had the baby. To like, she's like, okay, it takes like 6 weeks in this particular place to get physical therapy started for like the postpartum specific stuff. So get on the list now so that when you're 6 weeks postpartum, when it's safe for you to go do this, you're already in the system and you can just start going, make your appointment like as soon as your baby is born. And I did that. And so 6 weeks postpartum, I was at the physical therapist, and a year postpartum, my core was stronger than it had been at any previous time in my life, because we started right then. And it just, compared to my first baby when I didn't. And then after 2 babies, when everything's obviously a little bit even worse. And then doing that, it was an amazing thing. And it's just like, these are things that everyone should have access to.
Yeah. I mean, I had polyhydramnios gave me a ventral hernia. Mm-hmm. And I mean, the good news is when you have an actual hernia, the insurance company is like, oh yeah, we'll pay for that. Mm-hmm. I was like, well, that's the good news. I mean, if it had just been diastasis, recti separation, they probably would have been like, I don't know, is it affecting you in any way? And if I couldn't prove it was like severely causing disability, they'd probably be like, nope. But and that's one thing a lot of people think is, one, you have to do the right kinds of exercises because the wrong ones will make it worse.
Mhm.
And two, a lot of people are like, well, you need to strengthen the muscles. Well, your diet, the separation is caused by your connective tissue
Right.
weakening. So no amount of stronger muscles will cause that to change. It's kind of like a fact of life. If you do the wrong things, it can make it worse. But you can do some things to help if it's bad enough. But if it's too bad, that the only thing that will fix it is surgery to repair the damage to the connective tissue. I mean, people have to understand it's damage. Pregnancy can damage your body. It can damage it in real ways, and it can damage it in ways that will affect you for the rest of your life. And you should take it seriously. And if your provider is not taking it seriously, please find a provider that will take it seriously.
Exactly. And you know what? The reason I went to the surgeon was because I had a hernia, an umbilical hernia that was done. I actually got it probably with Gavin, was undiagnosed. Nobody found it. When I got pregnant with my second, my doctor knew about it right away, felt it right away, and was like, you have a hernia. And I was like, what does that mean? Also, my belly button was popped out right away when I barely even had a bump. And that's apparently a sign of hernia. And so I didn't know that. And so they were like, my doctor was really cool. She's like, we just have to keep an eye on it. We normally don't do surgery while you're pregnant, but we can if it's needed. So she's like, but we're going to keep an eye. And then afterwards they were like, we're going to keep an eye on it. And sure enough, afterwards it didn't go away. It just got worse and worse. And so like I called her, she's like, nope, that's it. You have to get it repaired. And so I went in and they were like, oh, it's little, it's whatever. And then they got in there and they were like, oh no, it's way worse than we thought. And I ended up getting the mesh, and they were like, and it was like they were supposed to be like a little thing, and it's a big old scar now. Like they were like, oh, I'm like, it's worse than my C-section scar. Like it's way worse. And I was like, oh my God, like the stuff that they did. But I was like, okay, at least I've got my hernia repaired. But as years had gone by, and I realized because I have this, my muscles is like this, I start getting stuff is poking out between my muscles. And unfortunately, they were like, well, you're probably going to get another hernia. And I was like, well, I want this fixed. So I don't want to keep getting surgery for hernias because my muscles are like this. Like, I was like, I don't want to deal with it. And so that's why I was sent to the surgeon. And the surgeon's like, well, we can do stuff like that. But you know what he told me? He was like, you're better off waiting till one of those actually is like, we got like, this is a hernia spot. Yeah, we're going to repair it. And then we can do the surgery and it will get paid for by insurance. But he was like, other than that, you're going to have to pay out of pocket and make sure you're done having kids because you don't want to do this again. He's like, you'll want to do it one time he's like, we don't do that again. And so I was like, okay. So it's just kind of one of those where I'm like, well, all right, and it's going to be real fun. Like if I go to have another baby, they have to check my spot already that's there. They have to check it during the C-section. And then I'm like, sew me up, like do everything, just do everything you got to do. Because I don't want to, like I told my doctor, I'm like, I don't want to keep having surgery for the same crap over and over because it's because it's just open. Like I was like, I don't like that. And it's like a weak spot of your body that it sucks. I wish I would have been sent right away. Like just send me because I didn't even know that was a thing, an option to be sent to a physical therapy. Like I found out and I was like, well, now my body's been like this for years. Like, it's like, oh. So it sucks. At least your doctor was on it. That's good.
Yeah, I love my doctor. She's been great for a lot of things, like good and bad. She's always been there. It's really good to have good care like that.